Hi, my name is Sarah Arshad. I came from USA and to do stem cell therapy for my son, who was earlier diagnosed with mild autism. He was about 2.5 years old when we find out that we're having some difficulty him growing up, and we have some doubts. So we find out that he was on a delays, and later on he was diagnosed with mild autism. Being a mother with an autism child, the day you find out is just, it's not the same anymore because they're growing and their symptom is growing with them. And it's just, I don't know how to explain my journey, but first that's where it started. He started growing, his symptoms growing, and we were doing ABA back and forth. We weren't seeing much result at first, and then so many changes for him as well. And as a parent, it was tough. And when we came to know what it was and how to deal with it, it's not only him going to therapies, it's as a parent, we're going to therapy as well. Yes, today with the autistic child, it's just not easy. It's a very emotional moment for parents. And it's the day, that moment when you realize something wrong with your child, and then you have to explain everyone around you that, because he seems normal to other people because he have very quiet personality, and they thought it's normal, you have to explain your family what's wrong with him. First, when he was diagnosed, it was only a speech delay, and he was saying words and he was far away from his milestones. He should be speaking sentences. He was around 3 and 3.5, and then he started looking down. His eye contact wasn't balanced. His focus span was very low. But he does have other abilities which, describe his personality. He's a very, I would say it's study-wise. Intellectually, he's not, I wouldn't say he's not very smart, or he's not very, he's antisocial. He doesn't like big crowded area. He started getting better, but it's still not there yet. It's still very shy away from the crowd. And he also have certain repetitive behavior, like washing his hands or smelling his hands. He likes very clean environment, very germophobic, I would say. So when we were talking to Sadaf back and forth, about, she was showing us a video, the results of other people who have similar symptoms or similar, diagnostic. We got here, we got to pick up from the airport, and we went to our hotel, relaxed, and the very next day we start our first vaccine process, and she explained us how it's going to work, which day and which time they're going to pick up, and what are the vaccines and where it's going to take place, and what is the procedure is going to be like. And we're going to take his bone marrow and inject in his spine, armpit, and his hand. And she also explained us they're going to give us therapist, and they're going to give us the diet plan, 1-year diet plan. So while he's producing new cells to keep it in a good shape, and so we can see the developments. It was a lot of information. They explained us very well. So it was a good, actually talking to them and going through a process.